So let's get started. So the overview of today is that we are going to be doing, we're going to talk about foam rolling, and then we're going to do foam rolling. So I hope you're all prepared to get on the ground. If you have to, you can watch. But ideally, you all are able to feel very comfortable with the foam roller, that when you go home today, that you're comfortable doing the foam roller and doing multiple areas of the body. And that's the whole goal of today, is to do that. But we want to make sure that it's simple and that it's fun for all of you. Okay, so let's start off with true or false. True or false? Foam rolling can help reduce muscle soreness after exercise. What do you think?
True.
True. Very true. True or false? Using a foam roller before a workout can improve flexibility and range of motion. True. Very good. True or false? Foam rolling should be done quickly and aggressively for best results. No, don't do that. Foam rolling can help improve blood circulation in the muscles. True. Yes, it pumps those muscles. Foam rolling is only beneficial for athletes and not for everyday people.
False. We're all athletes.
But we're all everyday people, and we're all wanting good bodies. And so this is a show called Everyday People, and that's everyday people. Okay, so why should you foam roll? It does improve muscle recovery and flexibility. It reduces muscle soreness and tightness. It enhances your blood circulation, improves range of motion, and of course, improve your spinal health. My little heart for your spine, right? Okay, so why is your chiropractor recommending you do foam rolling, right? So we've got the good spine and we've got the bad spine. All chiropractors are going to want you to have good spines, right? There's so many reasons why it's important to have a good spine. The most important reason, who would say, for what system in your body is it most important for? That's right, the nervous system. Because you want to have the spine to be protective of your nerves and allowing it to function the way you're supposed to, because the nerves have to go through to get to your brain. So there's so much benefit to having a healthy spine for your brain, for your function, for your cognition, for everything, right? So it's most important for that. So again, the good spine is good posture. The bad spine is bad posture. Again, bad posture is going to lead to compression of your heart and all your internal organs, right? And your lungs, so you're not going to have as much energy. You're going to wear out faster. There's so many things that just bad posture is not good for. So we are always trying to help you away from bad posture and into good posture, into a good spine. So your chiropractor is recommending foam rolling because there's these things that you can do. Extending your spine. We'll get to how to do that today, but you're going to learn how to extend your spine. It will increase better blood flow to your spine, to your brain, better circulation to the brain. It releases endorphins and enkephalins, so those are the feel-good muscles, feel-good hormones, and then it just helps to balance out your muscles. So if you're tighter in one hip than the other, by working a little more on that, you're going to help to get that balance in there too. So that's always a good thing. Okay, so who has heard of the three-legged stool? Hopefully all of you have heard of the three-legged stool. No? Okay. Well, let's talk about the three-legged stool. So chiropractic wants you to get the best the best results for your care. And if you follow the three-legged stools, that's going to help you to get the fastest and the best results that you're looking for. So if you're doing your adjustments in rhythm, all of you have had a plan where you're getting adjusted maybe 3 times a week and then twice a week. And we do that intentionally so that one builds on top of the other. And then that last one helps you to build on this one. So if you go for a long time or you have injuries in between, you're not building on top of that last adjustment. And that's why we're doing it, so that you have that to build on top of each other. The other habit to have, the other stool, the other leg of the stool, is breaking bad habits, right? So if you're constantly rounded and having bad posture, whether it's you're on your phone, you're sitting and driving with bad posture, you got to stop it, get those shoulders up, put your phone up here. Some of the things like purses, right? So sometimes we'll have that. We recommend balancing that out, trying to find areas that you're causing harm to your spine, so you stop it. And then the third leg of the stool is corrective exercises. So we're going to learn more about where we're weak and where we're tight, right? So those are going to cause issues. So if you're not having a healthy spine and a strong muscles to support your spine, you're not going to have a good spine. So you want to stop the bad habits, but also then strengthen the spine, but also help having a good flexible muscles around the spine, right? Breaking up all that scar tissue that's around there. So that's where foam rolling falls in place, is the corrective exercises. So the illness wellness continuum, we have this when you first start with our office is to ask you, where do you think you're at in this continuum? Because all of us fall somewhere here, right? So some of us we have good health, but we got injured, and so we want chiropractic to help us. And oftentimes we think that chiropractic is only because we broke something, right? So we hurt our spine and we need to get that fixed. But our goal is to help you understand that the more that your spine is functioning, the healthier that your spine is functioning, that's going to help you along this continuum so that you're really healthy and that you're functioning at 100% and going that way. So some people will start in the disease phase where they're on medications, they have lots of symptoms, they just don't feel good. And that's at the very far left of the illness continuum. And as you get healthier, your symptoms start to go away, getting to where you're having no symptoms, but you're also addressing other areas in your life too, right? Your nutrition is addressed, you're exercising. If you're just neutral, it's sporadic exercise, inconsistent nutrition, and health is not much of a priority. But as you get here, and this is what we're encouraging all of you, right? That's why you're here, is that you would regularly exercise, have good nutrition, you're constantly learning about wellness, so you're finding the areas that need improvement, and then you have minimal nerve interference, and that's your chiropractic care. Optimal health is 100% function. Your body works really, really well. You have continuous development, active participation, and a wellness lifestyle, eating, sleeping, drinking, all the good, healthy things for yourself. So today we are going to foam roll with a purpose. So I want you to have the chiropractic perspective of why and where your body starts to break down when you have bad posture. So there's two things that happen in the body that they've named it the upper body cross syndrome and the lower body cross syndrome. So it's the crosses where you're super tight on one side and tight on another side, and then you're going to be weak. You're going to be really tight here, and then really tight here, and then weak. So I'm going to go over that. But this is what we're trying to target. So and this is often what we do, right? We do this a lot, most of us, or we're reading or we're driving and we're in this position. So in this position, this muscle, which is your hip flexor, is really short and it's tight. In order to get this short and tight, the hamstrings back here are long and stretched out. Does that make sense? And then if this is short and tight, then the abs, the stomachs, they get weak, and then back here, that's also really tight. So what we're trying to do is stretch out. We're going to target our hip flexors and then the low back as well. In the upper body, going like this, we also do this, right? So this right here, your chest is going to be really tight. They call this inhibited, the neck flexors are inhibited or just weak. And then the scapula, the shoulder blades, so you were saying shoulder blades, the scapulas can be weak as well. And oftentimes they get tight because they're weak, and the body just, instead of strengthening them, they get them tight. And then back here, the upper back, the traps, they get tight. So we want to help to break that up, and that's what we're going to target. So I'm going to have this on our view as we go forward. So then another thing to think about is when you're having that bad posture that we're all trying to fight, when our head is over our body, that's the most efficient way to carry it. But as our head goes forward, and that's what these numbers are referencing, is that it magnifies how heavy your head is, and it accelerates how fast you're going to wear out. So none of us want to wear out fast, right? So we want our head over our body so that we're healthier and we're not wearing out our spine. Okay. So foam rolling is a massage technique. So you're asking about, it's a poor man's massage? Yes. So myofascial massage, it's a release technique. So what is the myofascial? What is that? So myo is muscle, fascial is fascia. So when you look at a muscle on our body, right, we all know what the muscles are, they are wrapped with fascia. So there's a superficial layer that the fascia wraps around the big part of the muscle, but when you look at the individual fibers of the muscle, the fascia wraps around that too. So the intention of what we're going to be doing with a foam roller is to put pressure on it, to relax it, because if you think about how tight you are, and when someone just goes, relax, relax, and there's a little pressure there, that muscle relaxes. That's what you're doing with a foam roller, is you're helping your body relax, period. It's a fancy term, the parasympathetic. It helps you to just tap into that part of your body, so you're relaxing. The other aspect is as you roll it, you're actually going to help to move the circulation through that area and flush out toxins that are built up in there, and bringing in the good oxygen and nutrition that should be in your body. Let's go back. Nope, this way. Okay. So there's deep and superficial. So you can do light rolling and you can do deep rolling, and you're going to be targeting different areas of the muscle. Okay, so how to use a foam roller effectively? Slow and controlled motions. You're focusing on tight muscle groups for 20 to 30 seconds each. You're going to roll directly, avoid rolling directly on the joints. Breathe deeply and relax while rolling, and do it on a smooth surface. I picked out this picture because I thought it was funny, like who's in the desert on rocks? I wouldn't recommend doing that on the desert and rocks. So smooth surface, clean surface, and then it's really easy to do almost anywhere. So the common areas, and we all have a sheet that you can reference to, are the hamstrings, the calves, the IT band, the back, the quadriceps, and the hip flexors. So we're gonna get going doing that. Yep, so let's roll. So you guys ready? We can move our tables out, grab a foam roller. Okay, so the first area that we're gonna start with are the calves. So calves, right, the back of our legs. So if we start, so the muscles go to the tendons, and we want to get the tendons as well. So it doesn't usually feel good to work on the heels or the bones, but we're gonna work on the tendons, right? So doing this, fairly comfortable for all of us, right? So there's hardly any pressure, but you're just gonna go a couple inches if we do this, right? A couple inches going back and forth, and so you can do it without being on, most of you already know, you're gonna have to elevate your butt to get a little bit more motion in there, right? Is that comfortable? Is that easy to do? So you can do it where you have a little bit of pressure and you're doing both legs at the same time. You can also make it a little harder for yourself, but you're gonna put more pressure on one leg and just...
Which leg should you cross? It doesn't matter?
It doesn't matter. So, but the one that's underneath, that's on the foam roller, is what you're getting, you're targeting. And so you can, raise your butt and just go up and down easily, nice, right? And then from here, if you wanna just sit here, you can go and rotate your leg. And then that way you're just getting the tendons, but in a different way too, and you can feel that pressure. And the more you put pressure on it, you're getting the deeper layers, right? Does that make sense? A lot of times there's knots that are in here that it's tugging and pulling improperly, so that you're constantly getting irritation, and then it causes that plantar fasciitis, and then eventually it leads to bone spurs. So yeah, you want to increase the blood circulation and the mobility of that area so you don't get those bone spurs, because then it's bad news. You have surgery, and then they still grow back because you still have the problem. They never got rid of the knots that were up north, right? So how does that feel? Comfortable on that leg? Yeah. Okay, so then as we go a little closer to our bodies, we're going to get to that belly of the calf, right? And this is what you wanted, right, Jackie, is figure out what do we do with these calves. So now you have heavier parts of your body on that foam roller. It's a little more pressure. Maybe you don't need to one leg on top to get that, but you can do that too, right? How does that feel if you do? Yeah. So it's just easy and pressure. Okay, so yeah, you want to not to do two legs, right, or do two legs at the same time, not more pressure. So you're just trying to get a light blood flow, and that's the encouragement. Is you want to do it where it's comfortable, that you're willing to do this again, not like, oh my God, I hated that. That's the intention, yeah. And it does take some time, because when I first did this, I thought this was the most painful thing I've ever been experienced. Like, why would people do that? But it was like, these areas have never had that pressure before. I didn't have regular massages back then. Yes, because you have to get your body up. Yeah, your core is engaged, absolutely. Okay, now when your calves go and cross the leg, right, you're going to have your hamstrings and your calf muscles cross that knee joint. That's going to get a little sticky and icky, so you might feel a little more soreness, but that's in a very important area to target. So as we go a little bit closer to our body, how is that feeling?
It feels good.
Yeah, and so again, you're just moving things around, but you can also elevate your butt and move it around, but you don't have to. How does that feel? Good? Still sore? Yeah.
So when I
So-
look at my hands, I don't know, I get a lot of tingling in my hands. When
Oh, because you're doing this. You probably have a lot of tightness here that we'll need to work on that
hands.
too.
That's part-
Yeah,
when I
yeah,
do this,
because you're
I-
going here, you're cutting off the circulation because it's
Okay.
already tight to begin with, and then you're adding more tension. Yeah, yeah.
That's good.
So are you able to just a little less pressure on the foam roller?
Yeah, that's what I'm trying
and just do it where it's comfortable to you, so you're still just getting some motion. Okay, so we are focusing on the calves, and we're just slow and steady, right? So now we're at the knees, and we're going up north to our hamstrings. So the back of the thighs, this is a thicker muscle. Hopefully it's not as tender to you, but we're just going to go an inch above the knee, the break in the knee, right? So right behind there, and now you're going into the hamstrings. How does that feel?
Like that.
Okay. Is that easier for you too? Yeah, okay. Yeah, this is a nice muscle. So if any of these muscles are too uncomfortable, this one is always easy to go back to because it's just a big muscle that it could take the pressure.
And how long should you do that?
Yeah, I do like 30 seconds to a minute and a half.
Okay.
Yeah, so you're just doing a few, stroking up and down and then move. And then you're just, but if you find a spot that's a little sticky and icky and tight, then I just put a little pressure there and hold on to that.
Stay on that a little bit.
Yep.
So how much should we elevate the tush when we're doing any of these? Would it be the same for all of them?
Pretty much, yeah. And then you want to probably bring your arms a little closer because you're about to fall down.
Yeah, I'm sitting in that tush.
Okay,
So
so
what is the best way for the shoulder? Because, I tend to do that and I don't want to.
yeah, elevate it. Yeah, so that's very active, right?
Yeah.
Yeah, it makes, and then again, you can always cross the leg to put more pressure, but you want to cross it at the thigh now. Can you feel that? That's a little more pressure. Okay, so we're pretty much straight over on the hamstrings. So the hamstrings, you have the outside of the hamstrings and the middle of the hamstrings. So you can roll over a little bit to one side and get that part of the leg, so you're getting the outer part of your hamstring. And this is going to be helpful as you're working with your sciatica, right? So your hip is that you're trying to get the hamstring, and as that hamstring starts to attach to your butt bone, your pelvis bone, that will help to get more flexibility in there.
You know what? This would also be good for cellulitis.
That too?
Wheat,
Yeah.
maybe.
Yeah, because you're getting more blood flow in there to access it. Yeah. And so again, you could do one leg, and if you prop up one leg like this, you're doing the same thing, then you can put that pressure here and maybe you have a little more control too. How does that feel? Easy enough? Yeah?
I have a quick question. I wear splints sometimes
Okay.
for carpal tunnel, and I also have that arthritis at the base
Mm-hmm.
of my thumbs. So this
Is uncomfortable.
is very uncomfortable.
Yeah,
Would
yeah.
wearing a splint when I'm at home, do you think that might help with that pain or uncomfortability?
Maybe,
Because I really
but you're
can't
flexing and you're
hold
putting
my
pressure
weight
on.
up like that
Yeah.
very long.
Yeah.
It just, this right in here is just real uncomfortable.
How about if you had foam or something? Something.
I don't know
like,
that you could do
like
that.
A yoga mat or
Yeah.
something with
Can you go on your fingers?
No,
Oh,
because
can you go on your
my
knuckles?
Fingers and, I've got arthritis in my hands.
It's
in
all
general.
there. Yeah.
If you
So
have a firm mattress like I do, I actually have
I have
put mine on
Tempur-Pedic,
the
so
bed.
it's
Not that
enough
firm.
To do the
Yeah.
foam roller on. I have a yoga mat that I put on top of my rug in the living room.
yeah.
Because I do have a foam roller at home that I use mostly for my back.
Mm-hmm.
But, and I don't have to, support myself in any way, so I've never thought about doing I do these, but I do them laying down sort
Yeah.
of.
Yeah.
Back and forth, so I'll just try it with my wrist things and see if maybe.
You try that, yeah.
help.
And have your doctor adjust your wrists. Did your doctor adjust your wrists? Your chiropractor?
Well, I haven't even asked him to. We've been concentrating so much. When I came in,
Mm-hmm.
because of the surgeries, because of the non-weight bearing, because of everything else, I was so rotated, you could only see part of the.
Oh, wow.
pelvis on this
Yeah.
side. The rest was rotated
Yeah.
out of you.
Yeah.
So we've been really working to get.
Yeah,
me-
yeah.
This has just been nothing, because
Okay.
I keep normally it's not that bothersome
Yeah.
with a split, but this is.
Not good. So, but now that you're getting healthier,
You're right.
now it's time to start working on your wrist.
Yeah.
And so if you can get better mobility and get those joints moving, then you
Yeah.
should be able to put pressure.
Now
So that should be
I
something,
have the mobility, it's just.
but putting pressure, the
Putting-
mobility and the pressure. Yeah,
Yeah.
so we need to be able to get there. So let's
Yeah, I'll
get
talk
some
to him
adjustments to your, yeah.
the next
Okay.
time about it.
Yeah, so again, we're breathing into the area, so you're just moving and breathing. Now we're moving up to the hip rotator. So the hip rotators are your hip muscles, right? Your glute medius, your glute maximus. So you're gonna be sitting on, okay, maybe we can do this without, now we gotta be very, but
Balancing on it is.
balancing on it,
the
yeah.
whole weight on it.
Okay, So the goal though is the sacrum doesn't have a lot of muscle, so you're not focusing on the sacrum. But somebody we might need to do. So you're going to the side of your butt. So if you can do your fingers, can you do your fingers?
I think
Yeah.
so.
Okay, so doing our hip flexors. Yep. How's that? Can you do that?
You're on the side of your.
You're on the side of your body. Yeah. So you're trying to get the big, bulky muscle on your butt.
Like a 45 degree?
About 45 degrees, yep. You can go a little more, less than 45, and then all the way over, and you can feel where your hip is, right, the top of your femur, and you're getting into that hip flexor. So we're just doing one side for now. What's that? Yeah, so that will help. So you don't want to do it where it's painful, and if it's really inflamed, it's not comfortable, but you can work around it and find the areas that are a little less sore, and you're getting blood flow, and you're also loosening up that muscle so it's healthier, right? So a lot of times the problem is the muscle's so tight, and you're just putting a little pressure, little love, little breathing into that area so that it will relax. Not working out for you, huh, Jackie?
It's a struggle, but I'm gonna master it. I'm
Okay.
just taking a break.
Okay, so can you look all sexy like me? So get perpendicular. There we go. Okay, so you're on your right hip. Yep, you got it, you got it. And then bring your hand a little bit closer to your butt. There you go. And now bring your butt away from your hand. And that leg too. Yep, keep going. Keep coming towards us. Yep, yep.
Where do I leave this?
We're rolling it.
I was
There you
trying to
go.
figure out how do I get to this.
There you go,
because I
yeah.
can't get to it.
And you can feel it, right? It's not painful.
No.
No.
But it was hurt. I was struggling to get up there because it was hurting.
Yeah. Okay.
That's why you're going, what is she doing?
I know.
Attacking me.
It's you versus that foam roller.
Yes.
Okay, and then so if we pause here and we just take a little bit less of an angle, and so we're more face up. Can you feel that different parts of your muscle, that butt muscle?
Yes.
And is it doing pretty good? Okay.
Can I do that with the longer one, or no? Because I only use it really for just stretching my spine.
You can, of course.
Wow, they didn't tell me that
No.
in Dallas where I moved from.
Okay. Well, now you're learning. We do things different in Houston.
Y'all are excellent at education, and
Yeah.
education is so important.
It is.
Because if you know what you're doing. and
Let's
why
switch
you're
hips.
doing it,
We're going to switch the other side. Can we do it?
Yeah.
Okay. We're going to roll back and forth on that other hip. You okay with that? Can you try to do the other hip?
I did.
Oh, okay. You did it.
But good.
Okay, good.
I didn't do it as long because I had a hard time getting my.
Oh, yeah. Okay. So again, we're breathing. It's comfortable. We're finding the sore spots, putting a little more pressure on it. Now, the advanced version, this is simple enough, right? You can bring that leg up. So the hip that you're on, and that knee that's bent. So you're going to be,
Like this.
which hip are you working on? Are you working on your,
I should be working more on the right because that's.
Okay,
the one
yeah,
that
yeah, yeah.
sometimes gets compromised.
mm-hmm. Okay. So yep, you're leaning right,
Leaning.
and then you're bending the right knee. Nope, no. Keep the left leg on the ground. Yep. And then you're putting your right knee on top, your right ankle on top of your knee.
Like this.
Nope. Put that one back down. Now put this ankle on this knee. There you go. And open up right there. And then you're tilting, because you're rotating that hip, and those are the muscles that you're trying to target.
Yeah, that's
There you
much
go.
more engaging.
Yeah.
It's not this leg, it's the other one? No.
It's that leg. You got it. You're doing the left hip. She's doing her right hip.
So the side that you're foam rolling, your leg should be bent.
Yes, that one. Yeah, so you're
I could do
rotating your hip and you're on those muscles. Yeah. Okay, that's still a tender spot, right?
Yeah, that side, my right side is much more tender.
Yeah, okay. Find a sore spot and breathe, right? Hold it and breathe. Okay, so as we move up the body, typically we skip the very low back. So from the sacrum, from all the lumbar spine, some people will have a condition where their bones go forward. So if you're foam rolling and you're pushing your bones that are going more forward, not good. So we're going to just skip that part altogether. We're going to go up to the mid and upper back. So we're going to start at the bottom of the ribs. So those bones that have ribs attached to it, we're going to start there, and then we're going to go up.
So
Okay.
always avoid the low back.
Ask your chiropractor if you can.
Because I've done it where I put like my butt on it and then my upper back on the floor.
Yeah, and so if your spine has the integrity to be okay with that, then that's fine. But if it doesn't, don't do it. So I have not seen your x-ray. Maybe I did see your x-rays, but ask your chiropractor. I don't remember. You have extra bone. You're L6, huh? Okay, so we're down at the bottom of the ribs, right? And so we're just doing a couple inches. So our butt is off the ground. We're very engaged in our abs. Yes, you feel that. Yeah. Nice core work. And we're just doing a couple inches right there. All the way up to maybe the bottom of your shoulder blades. You got that?
Yeah.
You going? Okay.
Muscle massage.
Yes, and this is that self-massage, poor man's massage. And this is what I want to encourage you to do, adding this into your regular routine. I love doing this before I go to bed because it just relaxes you. So you can do, I mean, who's affording a massage therapist every night? No one, right? So like,
Well, I scented candle.
Yeah.
I play spa music. And
There you go.
I do like
Yeah.
45 minutes. And then I just get up and go into bed.
and then you're winding down and it's so relaxing, yeah.
Yep.
Okay, so as we continue to go up, we're now going to the middle of the back, a little bit more closer to the shoulders. And you're relaxed, so your butt's a little higher off the ground and you're grounded with your ankles into the floor. Very simple. Now as you take your arms up and then over, if it's comfortable, you can arch your back. Can you do that, Jackie? How does that feel? Yeah. And you're moving it. Very nice. Slow and steady. Yep, you're doing it. Does that feel comfortable?
To me?
Mhm.
No, man, can we?
Is that uncomfortable?
No.
No, yeah, you're doing great, yeah. And so we're breathing and moving. Is that less painful for you too? Or if it still hurts?
No, it's better.
Okay, yeah, so you're just finding those thicker muscles?
So balance,
Yeah,
that it'll slide off.
right.
Yeah, that's good.
Nice, yeah. Next, we're going to do thoracic extension. So we're already there. So here we're just holding and we're going to extend. So we're going to keep our butt on the ground and then our upper back is on the foam roller and our hands are going to be behind the head and we're extending our spine. Yep. And then you can just hold it there and then come on up and then hold it there and come on up. You're stretching out this chest. Remember we talked about the upper cross syndrome where it's super tight. We're trying to unravel that and open up the extension, open up the back. Very good, very nice. And now bring it up a little bit, come up a little bit with that little ab, and then bring that foam roller closer to your neck, right? Not to your neck, but closer to the neck. See why, who wants to do this aggressively? These things run away.
Shoulders, like with your shoulders.
Yeah, and you're just getting more extension into all of that spine, right? Especially when we use computers, we want to undo the roundedness of that computer work.
Like
And
this,
breathe.
is this it? I can't see.
You are doing great, Jackie. That's fantastic.
I hope this is it.
Yep. Okay, and that's what we did.
Actually, it feels really good.
Bringing in the air, holding it, letting it out.
Are you supposed to roll or just lay still?
Lay still, yeah.
Okay.
And then bring up and back again. So it's like a little mini like sit up, kind of, right?
It slides off.
Then it slides away, yeah.
Flatten up.
It must be the shirt.
Like this, and like this? Or
Just a bit slower. Yeah. And then bringing your butt on the ground. Yeah. How does that feel? You're just extending it and bringing it up and then moving it. There you go. You got the bump. So we're undoing the grandma bump. We're not grandmas here, right? Maybe we are, but IT band. Okay, so the IT band is a very, very dense connective tissue that attaches your knee to your hip. And so you're going to be targeting mostly the front of your leg and the back of the leg to get the muscles that have the blood there, and then just some pressure. But sometimes it's super, super sore. So if you're already sore, this is usually the sorest part of your body. Okay. So we're trying to target that big white strip that's on the side. And if we go nicely, we're going to do that sexy position, right, from your side. And then we're going to hold up our body so we can do right in here. Okay. And so I'm going to start more from the hamstrings, and then I'm going to go right onto that bone. Are we good? You can play footsies. How does that feel? Okay, there you go. So just slow and control, just doing a little bit. A little painful?
Yeah.
Yeah, so you might want to do more your hamstring and less of your IT band until your body gets less sensitive, and then you can build up to this. Yep. And we're just doing a couple inches going back and forth. You're doing good? How does
On the ground or up on the ground or on the ground?
You can keep it on the ground, or you can raise it up just because you're going to be moving it, right? So yeah. Okay, as we do in just a little bit, an inch or two, and then keep going closer to your knee, and then you're going to move your hand. And so we're finding those sore spots, right?
One hand.
It's just short and small, yeah. And then you raise it up, right? So just slow and steady. And this can be a pretty good workout, right? So if you're just doing it slow and holding up your body, you're like, okay. And then you can also rotate that foot too, right? So that you're getting a little different fibers that way. And then as you get closer to that knee, that's that sticky, icky zone, right? And so as we're getting closer to the knee, but this can help prevent so many knee issues or help, your wrists. We got to build up those wrists. Now we know.
Oh, that's what, yoga has never been anything I've been able to do.
Because of your wrist?
Because of the wrist and the arthritis and the.
Yeah. Okay, so now I'm done with this knee. I'm all the way down to the knee. You guys ready to do the other side, or you want to move on to something else? Okay. Okay, so let's go on to that left hip or the other hip. Okay, slow and steady. We'll just do a few little swipes going back and forth. So you were doing that side before. You want to do the other leg, no?
I'll do that,
Yeah.
I
Yeah.
think I need a rest.
Okay, yes. This is a lot of effort to hold up your body like this, yeah. So this might be something, is it helpful? Yeah, okay.
I'm excited.
And you can feel like you could do this tonight. Okay, keep going closer to your knee. We're almost at the bottom of the knee now. Whew, this one's harder as you hold up your whole body, right? So the harder they are, the more pressure and the deeper the muscle you can foam roll, right? So some people will use PVC pipes. So the diameter, no, I'm not very specific on that. This is usually just average, and that's fine. But the harder, the more deeper. And the softer, again, that's going to be for more sensitive people. So you may do well with a much softer one. I forget your name. What is your name again? Shahara. So you might do well with a softer foam roller. So it's not as dense, and so the pressure is not as intense, right? Yeah, because they're going to be harder, right? It's very rigid, the tensile strength. So then you're going to have more pressure for deeper Spartan race guys.
Yeah.
Yes, yeah.
What about the foam rollers that have bridges, like,
Those are going to be very helpful for the deep muscles. So once you've been doing it for a while and you want to be able to penetrate muscles that are so tight, the big bodybuilder guys, they'll do those. I don't think it's as helpful to get into the smaller areas or on your spine. I'm not a big fan of that. Where is my clicker thing?
Right there.
Thank you. So they're helpful for less areas of your body, but they certainly serve a purpose. So the quads, this is easy, almost as easy as the hamstrings. So let's move on to the front of your thighs. What are we doing after this? And hip flexors. Okay, so we're getting closer to your knees because we're going to get to the hip flexors after that. So, so we're starting at the knees, and then we're going to go up a couple inches. And we're getting down to the, I don't know that we said how long this class is going to be, but it's supposed to be over in 2 minutes. We're going a little over. Okay, how does that feel? Is that comfortable?
Yeah.
Yeah, and this is, again, a nice thick muscle, so we can put a lot of pressure on it, and it's not as painful. I like this one. Now, the quads tend to be, they're close to the hamstrings. They tend to be very tight. And so foam rolling on this, maybe it's a little awkward than foam rolling the hamstrings, but it really is helpful. And so as we get closer to your pelvis, right, we're going north on the body, we want to get into that hip crease. And so if you can get to the hip flexor, now you're going to go more angled, so you're targeting one leg only. Because if you're straight on it, there's not a lot of pressure to really target those
What
muscles.
about like this?
You could do that. That's easy, right? Yes.
This one's better than.
Yeah.
Yeah.
Okay. And so then you can hold on
Yeah,
your
that
elbows.
doesn't hurt,
Alrighty. Okay, and then the hip flexor, that was remember we're doing foam rolling with a purpose. We're trying to get those hip flexors that are so tight when we're sitting all the time.
Right.
So this is a really, really good one. So if we're targeting that right hip, you're just finding those sore spots, roll it, move an inch, roll it, breathe into it.
Yeah, this doesn't bother us.
That's awesome, yeah.
Even though that side, the IT band is much more sore than the other,
Mhm.
obviously, because of all the time of
Yeah.
weight bearing.
So keep doing this, and then as your hands get better, then you can start doing the back. So let's tilt our body so we hit the other hip flexor. So if you're doing the right, now we're on the left. If you're doing the left, now we're on the right. Just up and down. That's a little more sore to you?
Yeah.
Mm-hmm. And the more that, like, if you can push your body off of the ground, it's less pressure. So the more you kind of let gravity push you into the foam roller, then again, that's going to be more pressure. So I'm not a big fan of the neck because I think that's a whole lot of your body on a little part of your body. So I don't like foam rolling the neck. I don't like foam rolling the low back because of the spondylos that we were talking about. You can foam roll your arms. That's kind of a fun area to do. It's a little awkward, and I don't have that in this routine here. But really, you can foam roll a lot of your body with it, just getting pressure and rolling on any muscle. That's healthy to do. So that's fun to do. Okay, so now the last part, we're going to move up the body. Got this thing. We're going to get to the chest. This is our bonus. Okay, hip flexor, we did that. And this is the bonus area. So our lats and our pecs. Okay, so this might be a little hard for some of you, but we're going to get this area right in here. So we're on our side, and we're going to open up our shoulders. So this should help your scapula too. So as you're perpendicular, but you can face the ceiling a little bit more, so your spine is closer to it. You're going to get more of your scapula, right? And you can feel that. How does that? You can't do that one?
Breathing does help.
And breathing does help. So you're thinking of your ribs, and they're opening up, and you're putting pressure on the muscles, the lats, which can pull down your arms, but also your muscles that attach to your ribs, right? So all those intercostal muscles, those are so helpful because you're getting pressure, and that's allowing you to breathe easier. No, not a fun. No.
I can't lay on that hip. On this
Okay.
table.
How about that? How about the other way?
That's what I'm doing, is
Does
switching.
this help the traps too?
Mm-hmm. Yeah. So the more that you go now face up, you're hitting more of the traps, right? And then but here you're getting that lat, you're getting that scapula. You okay? How does that shoulder feel?
Yeah, it's just rough. It's the
Holding
weight
up,
I've
yeah,
been putting on it.
yeah. Can you go on your side now? How does that feel? And then as you get more comfortable, you can start rolling on your chest, so you're getting the front of your rib cage. How does that feel? Is it awkward to get it to roll?
A little awkward.
Yeah, yeah.
Not too bad.
But you can feel like where the muscles crisscross, that gets a little more tender and sticky and icky, and that's like just putting pressure there can be very helpful. You don't have to roll so much. Is that sore? Yeah.
No, I mean, it's just working through it, right?
Yeah, yeah. Okay. Let's do the last side, and then we're done with our foam roller.
Do you are resting your head on the ground when you're doing the
I move my hips, yeah, to move my body. Yeah. Is that comfortable? Can you feel it? Yeah. Yeah. So you're just getting that armpit, that tight. Yeah. Yeah. This can be a very sore spot, but sometimes just that pressure is helpful, right? Just getting some pressure.
when I finish the other side, it actually helps.
Okay. Blood's getting in there. Yeah. Alrighty. Okay, as we slowly start to make our way up, we did it, y'all. So we targeted quite a few areas of our spine, right? And you have a cheat sheet to go back to. Some areas you might be skipping for a while and then eventually build up to get to that area. Some foam rolling tips. The best time to foam roll is before or after an exercise. So you can get that increased range of motion before you're going to exercise, but also flushing out soreness, right? The toxins after your exercise. I love the before bed because that just helps you to relax. It relaxes your muscles, and then it's a good wind down.
Stay away
if you can stay awake, just stay awake. And ideally you're doing it 10 minutes. Like, it's not supposed to be so overwhelming that you're not doing it, that it's easy to get down, just do it, do something, and then move on, you know, and the more that you do it, the better you get, the easier it'll get, and your body will get used to it. And then get creative. So yeah, you can foam roll your forearms, right? So you can do other areas, just, oh, I'm tight here, let me see what if I just foam rolled sitting at a chair? Try that, you know, so you're just being creative and getting motion into your body. The takeaways, it's all about the nervous system. That's why we're doing this, right? So we're trying to make sure that the nervous system is healthy, having a good spine, strong muscles, and flexible muscles. So be intentional with your targets, trying to unlock your hips, unlock your shoulders, unlock your lats, and then adding in strength exercises. So your doctor should be able to give those to you so that now you have some flexibility tools. You want the strengthening tools too. And we only have one spine, so take good care of it. So did this workshop help? Did we answer all your questions? Yeah.